But Georgia, and this has changed, but I'm going to say it anyway because it's changed over the last year, had the second highest childhood obesity rate in the country. Right here in the Peach State. What happens to kids when they get overweight and they're obese? We see it in our practice. They have diabetes. And as I say these diseases, I'm thinking of patients that I'm actually treating right now that has this. 12-year-old, 9-year-old. Sleep apnea. They lay down, everything falls down. They can't get air properly through. Sleep apnea leads to heart disease, right side heart failure, pulmonary hypertension, high blood pressure, pulmonary hypertension, which then leads to systemic hypertension. Liver disease, they get gallbladder disease, gallstones. And they're not 40 and they're not fair, but they're fat. So that's what happens. Joint pains, orthopedic conditions, knee pains, lower back pain, ankle pain, and obviously high cholesterol. It's been well mapped out what happens to fat cells, how fat cells impact our health. Fat cells are called what? Anybody? Adipocytes. That's what they are. They have a lot of Th1 and Th2, a lot of inflammatory cytokines are in fat cells. Because of that, they are going to impact the immune system, the vascular system, and cause the metabolic syndrome, hypertension, and diabetes, and lipid abnormality. So when it's impacting us as an adult, we're the ones who are going out, we're buying the food, we can blame ourselves. But what happens when it impacts our kids? When we're bringing this stuff home, and they're eating it, they're not getting activity, most of the time, when people who are in their 40s on up, let's put it that way. When we were growing up, we'd come home from school and then we'd be outside all day till it got dark, then we came in. Now it's very different. They come inside. Everybody's afraid they're gonna get kidnapped. So they bring them in the house. I'm not kidding you, because this child abduction thing going on now. Nobody abducted kids back then, not to the level that they're doing now.
Bring them back.
And we played. I just remember playing all the time. Running around just playing, happy. Kids don't do that now. They get inside. You tell them to go outside, it's hot. They don't want to go outside.
Xbox.
Xbox. TV games, video games, cell phones. Okay, the kids now, it's predicted that the kids that are raising up now are going to live shorter than their parents. And this is when it's become a problem. Ignorance. A lot of us in our 30s and 40s and 50s will see kids that are overweight, but to us, it's normal for them. So 75% of the parents here in Georgia don't recognize that their kids are overweight. Why? Because they're overweight. That's it. They weren't overweight as kids, but as they've gone through life and they've picked up that over 30 weight and picked up more over 40, and now they're in their 50s, they just forget it. So they're overweight. And so they're not encouraging their kids to do the things that they need to do, the lifestyle things, to make sure that they stay healthy. So something has to change. It's time to be stronger than the thoughts that hold us back. And that's where the Strong for Life program comes in. Children Health Care of Atlanta, there's 3 campuses, CHOA, CHOA. They have put together, they have a big childhood obesity initiative. They actually partnered with us a little bit in our last 5K run. They provided, the schools that participated in the run, they provided a training program. They went in the school and educated the kids on healthy lifestyle. But they've gone further. All the pediatricians that have privilege at Children's Healthcare of Atlanta are participating in this program. And it's really just to educate. There's four principles, 4 tenets that I'm going to talk about real quick, but it's important. Now, I don't have time for the video. There's a 25-minute video that I'm going to ask the providers to view, log in and view. It's an educational video that teaches you how to interview. You know, you can't do like what I do and say, "Ma'am, you know, your kid is fat, and what are you going to do about it?" There's a way of doing it. They're going to shut down. You have to approach it in a positive way. Meet them where they're at. And if they're only willing to make one change, go with it. That one change is going to take them a long way. If they're ready the next time they see a little result, they make another change. But anyway, that's the video. So the program goal is going to use tools to educate patients and families about the Strong for Life principles, and there's 4 of them. Set goals to improve healthy behavior and effectively manage patients who are overweight or obese. So we're going to use motivational interviewing. So we're at this point, you know, we're not going to blame them, even though it's their fault. But we're not going to blame them for doing the things that you know. Seriously, there's a lot of laziness that happens. You know, it's easy to eat out. It's easy not to exercise. It's easy to sit in front of the TV. It's easy to do. We've just become a generation of easiness, and it leads to disease. We have to evaluate the effective use of the Strong for Life components in the practice setting. And as a practice, everyone, it's not just Dr. Christie, but Dr. Anderson, Jackie, Christie, Mink, we're seeing peds. We're seeing all the kids. So we have to, at every well child visit, we have to do an assessment, a healthy living assessment. You know, right now we've reserved that for the back office staff, for them to, how many fruits and vegetables you're eating? You know, is it deficient in fruits and vegetables? Are you drinking a lot of sugar beverage? Are you eating a lot of sweet food? We have to make it more, because this is such a big problem here in Georgia, we have to make it more now of a priority. We have to prioritize it, and we have to spend those 4 to 5 minutes educating, listening and educating, so that we can get an impact. Our target population, age 6 to 11. So in our templates on the EHR, we're going to look at the 4 and 6 year olds template, but mostly the 7 through 12. And Julissa has already made some changes on the electronic health record, so it'd be easy for us to go through those 4 or 5 questions when we're in the room with the parent. Adoption of the Strong for Life health assessment. I'm going to show you what that looks like. I'm sure you can read it from there. Yeah. Let's hand those out. Everyone will have a copy of that. Very important. So the back office now brings the patient in. You have the kid, you have the parent. They leave this, they tell them, can you complete this? It takes, literally, if you can read fast, it takes a minute to pull it out. And the questions are, the first one, my child eats veggies and fruit. And it's a scale of 1 to 4. Do they eat it 1 time a day? Do they eat it twice a day, 3 times a day, or 4 times a day? What's the best answer? 4 times a day. Everything on the right side, this side of the page is good. Everything on this side of the page needs improvement. And our ultimate goal is to get them between 3 and 4. The next question, my child eats out. Some people may want to say, yeah, 4 times a week, I love eating out. It's not good to eat out because why? Salt, fat, sugar, you know, unless you go to healthy eating restaurants on a regular basis, but people are rushing in and out of fast food restaurants, right? I'm not going to name them. Golden Corral. Yeah. All you can eat.
That's fast food?
But it's a lot of salt in it. If you cook, when you cook your food at home, and I know people are busy, but it's always better to eat home prepared foods. And I'm not talking about microwavable food. I'm talking about food, real food. Okay. The third question, my child is active, not very often, less than 30 minutes a day, 30 to 60 minutes a day, more than 60 minutes a day. Research has shown, and this was never a problem back in the 70s when I grew up, but kids played at least an hour a day, 2-3 hours a day. We're trying to get them back to a 1 hour activity level. 1 hour of activity, not 5 days a week, every day. That's what's recommended. 1 hour. It seems like a lot, doesn't it? Wow, a whole hour. They need to be out there moving. They're growing. And kids that are moving at least an hour a day are going to be active. They won't have the issue of obesity. Next question. My child has sweet drinks, Coca-Cola, sweet tea, juice, sports drinks, and other juice drinks. Are they drinking that every day? Breakfast, lunch, and dinner, sodas, juices? All those juices really, I blame juice for a lot of this stuff. People
Sports
just
drinks too. Sports drinks have a lot of sugar.
The juices are just crazy.
What's your take on drinks like Coke Zero with the artificial sweeteners and things like that? How do you I understand that it's no sugar in those, but I guess do you have any problems with the?
Yeah, I don't like
sweeteners
them. I don't like anything artificial. But you know, if they're diabetic or something, I tell them that because they act like they can't give it up. You know, so some people who can't give things up, you really want them to drink more of what?
Water.
What's the beauty of water? No calories. No calories in it. It's a universal solvent. Everything, all our reactions in our body from chemistry work with water. You need water. If you want to lose weight, you have to drink water. Right? You need water for everything. Every cell in your body needs it. That's what you want them to drink, primarily. All this other stuff, they need more water. Yes?
So the sports drinks are primarily for when you're working out? Well, other than
Yeah.
that,
Yeah, and then, you know, they say that if you're, the electrolyte, people use it, well, you want the electrolytes, the sodium, potassium, a little bit of stuff that's in there. It's not a lot they put in there. Water is good too. It's the sugar. You know, you have to really look at like Powerade and Gatorade. They have a lot more sugar than they really need to because people don't want to drink things that are fresh, so they put sugar in it. But otherwise, it would be okay. And the dyes aren't that great either.
So, I'm sorry.
No.
What about the drinks like Crystal Light that say will flavor your water? You know, because
aspartame in it. And
Is it?
Yeah.
I have a hard time with water. I really do. I try to drink water, but I can only do so
It makes me vomit.
Like, it does.
Water.
It's just like
I hear it all. I hear it all.
Glasses,
That's why I'm
but I
laughing.
can't do the eight.
Put fruit
Don't go. You just want to drink it.
Put it in the fridge and then
Really?
pour it. Yeah.
Okay.
In a jug. Yeah.
Okay, I'm gonna try that. I've never heard that before.
Yeah.
I know lemon, but I didn't know like
yeah.
About
other
not
fruit.
liking water, yeah. I hear that a lot.
Okay, well,
I hear a lot, but
definitely do that.
it's amazing
Yeah.
how that happens.
I like ice water. I drink ice water all day, but yeah.
Okay, next question. My child watches television, or this is probably the biggest thing that's caused obesity. This lack of activity, but playing computer games, video games, and watching TV. We spend so many hours doing this. Now this is a good one because it says more than 2 hours a day. So that would be anywhere. The average kid now is probably watching about 3 to 6 hours of TV, or spending that much time, even on their cell phones, those smartphones that they all have now. You have to reduce that. they should not be spending that much time. We try to limit it, our goal is to limit it to an hour or less per day. That's the goal. Uh-oh, I think my battery's going dead on this anchor. Have you thought about trying a new healthy habit for your child? This is an important question because if they've never thought of it at all, they're not going to listen. It's going to be like this thing, they put up this barrier right away. So you start telling them stuff, they're like, oh, wait a minute, what are you talking about? They have to be thinking, well, when I walk up the stairs, my knee hurts, or I feel I'm getting teased from the other 40% of normal kids, because 60% of the kids are really going to be either overweight or obese. A lot of kids now, they're in there. I remember when I was growing up, 1 or 2 kids would be the fat kid. Now you go to a typical class, a 3rd grade class, half the kids, half the kids, go ahead, half the kids are going to be in that have that problem. So this is a healthy, it takes 5 minutes to complete. Once we get that information, then we look at it. Let me have one of them. And then we would sit down with the parent. And we would say, okay, we see that little John, that John is eating fruit and vegetables 1 to 2 times a day, and that you guys are eating out 3 or 4 times per week. He's not really active more than 60 minutes a day, and he drinks sugary beverages up to 3 times a day. So he has like 3 or 4 things that you can target. You want to ask them, which one of these do you think you can actually work on? And then the kid may respond and say, well, I'm not giving up my TV games, So well, which one, you wait for them to respond. Well, I think I can probably drink some more water. Okay, all right. Then you get your prescription pad at 5 minutes, and you want to document. Pass those out. And they're going to walk out with this. It takes 10 seconds for you to do this. But by giving them something, telling them they're committing to this, okay, we'll agree, this is fine. You decide that you're going to drink more water. You check the drink more water box. You put their name at the top, and then you sign it. This is a prescription. You're confirming it. You're going to drink more water and limit your sugar beverages. They walk out of there with a plan. This is their wellness goal. Once these kids, if you have identified them as being overweight, and they have a BMI of greater than 30, or they, on the growth chart, they're over 95% on the growth chart, they're considered obese. These kids need to come back every month because you want to reassess them. Have they been following up the strategy, whatever they say they're going to do? Okay? You weigh them in again. You can put as many plots on the scale as you want. So they have to come back every month. We have to do this for the meaningful use for our EHR funding from the government. We have to show that we're using our electronic health record. We're doing it also to comply with the maintenance of certification for the pediatric certification. So it has to be a practice-wide thing. Everyone has to do it. All the providers who are seeing kids have to do it. We have to do this at the well child visits between the ages of 6 and 11. Okay? Let me kind of run through the rest of this.
It's important to compliment them on the things that we are doing right, because we do want to motivate them as we're speaking.
So that's why you have to see them back every month. Right? I have, as you guys know, you see some of the patients that we see, and the poorer you are, the lower your socioeconomic status is, the higher the obesity rates are. So there is something about having money and having a healthier life, but it goes across the board. Okay, these are the things that have to be documented in the well-child visit. If this is not being done, and we're going to go over this in more detail at the staff meeting where everyone is there, but height and weight. How are we going to do a well-child exam without a height and weight? The BMI is automatically calculated if you put that in. The BMI percent is going to be put in there. And then blood pressure. We're supposed to start doing blood pressure at what age? Nico?
5 opens.
Is it 5 or 3?
It's 3.
I think it's 3. It's 3. Yeah, I think it's 3. So blood pressure should be there because you're screening them for hypertension, especially if they're overweight. Okay, so then we want a documentation of the patient's established wellness goal. We have to document it at every well child visit between the ages of 6 and 11. All patients, regardless if they're thin or big, we will be doing this wellness thing. We have to go through that. If they're going to be getting that, if they're getting it, if they're between the ages of 6 and 11. Okay? We can scan it in the chart, or we can use those numbers and document in the EHR. It's going to be documented in the chart as well. So the providers have to make sure that's in there. Use a prescription. That's the prescription that I just handed out. And then we want to have a healthy conversation with the parent and get the kid involved. These are the things. We want to limit the screen time to 60 minutes per day. Do you know what it is? I said, when you're sitting down watching TV, it's almost like, there's this hunger bug around. Okay.
Gotta have a snack.
You gotta have a snack, let's eat. The TV is just sending out waves. And
Dr. Christie. So I have a question. So what if you have a kid coming in, he's like 9 years old, and the parents are truthful and everything that they chart on here is on the right side? He really is eating healthy and gets a lot of exercise still and all that stuff.
We'll have that.
And they're not snacking or anything.
Good question. Yeah, but it's the truth. Well, obviously they're doing something wrong, right?
Mm-hmm.
Because if the kid is overweight, if he's over 95% of it, there's something wrong, right?
Well, sometimes I guess kids, like fat kids, and then all of a sudden they hit puberty, and all of a sudden everything, they shoot up and get skinny and get muscular.
I'm sure that's not the reason for the epidemic we're
Yeah,
having right
right.
now. No, so we're going to focus on the things that we can change, and the 4 principal things. Let me run through that. But there is ways to attack that. We'll talk about that. So the entire family must be involved. Look at that family. See, who's the mom and who's the dad? Can you tell who's who? Oh, they all look kind of the same.
Is there a dad?
Yeah, this is dad, and
This is dad.
I think this is
I think
mom.
that's mom. I think
This
that's
is
mom in
mom.
the middle.
But that's daughter and that's son. For the parents in denial or resistant, the kid's fine. She's healthy. She runs around a lot, She does everything she wants to do. But seriously, I don't have a plug.
She got that.
No, it's not over and over. Let me run through this quickly. Reflect happiness factor, meet them where they are, identify barriers, and plan ahead. And that's the thing, that's a key point. Focus on the kid's happiness, because the kid's not going to be happy. Many kids, I'm not saying some kids are probably happy being overweight, but most kids are going to get teased, they won't be able to compete with their peers. So you want to focus on not so much a health issue, is the kid happy? And parents are going to respond, oh, my kid is not happy. We want our kids to be happy. So that's something they tell us to focus on. Okay, the child with inconsistent results. You want to reflect on what they're doing, ask permission to tell them more information. You don't want to be lecturing. Investigate further, remain open-minded, and take smaller steps. Look at this family. It all runs in families. That's a healthy-looking family. See what's on the table? Veggies and fruits. But those are all actors, though. So.
Behind the scenes.
Okay, so for the child not reaching the goal, you want to reflect. You want to praise them for what they've accomplished. They haven't reached the goal, but you want to praise them for what they've done. Then you're going to modify your plan, and then make sure you include the child so they can be responsible for it as well. You have to get on first base before you can hit a home run. I don't know about that. I figure when you hit a home run, you hit a home run. You run all the bases, right?
But it's not a true home run until you hit the last base. You have to hit the first base first.
Right. So you want small, achievable steps. And the message should be positive, one habit at a time, and get the entire family involved.